Funding for the Maddy Report is made possible by grants from Comcast, the Spencer family, Chevron, Community Health System, Harris Ranch Resort, Producers Dairy, Caleb and Desiree House, Valley Children's Healthcare, and The Wonderful Company. Additional support provided by from the Maddy Institute, the Public Policy Institute for the Valley's public universities. This is the Maddy Report with Executive Director of the Maddy Institute, Blake Zanti.
Welcome to the Maddy Report. I'm Blake Zanti, Executive Director of the Maddy Institute. Today we'll be discussing work and economic insecurity in California with Tess Thorman and Sean Cremin of the Public Policy Institute of California Economic Policy Center. Thank you for joining us today on the Maddy Report, Sean and Tess. Really appreciate you being here.
Thanks so much for having us.
Well, for people who are unfamiliar with the PPIC Economic Policy Center, can you explain a little bit for a moment what you do at the center?
Sure, happy to. So the Economic Policy Center is a group within the broader organization at PPIC. And PPIC, for those who may not know, is a nonprofit, nonpartisan think tank that's mission is to improve and inform public policy across the state. So at PPIC, more broadly speaking, we cover issues ranging from criminal justice to health policy, water policy, just to name a few. And specifically at the Economic Policy Center, we were established 2 years ago to house PPIC's longstanding economic research. So at the Economic Policy Center, our main mission is to really think about policies that create a more robust and resilient economy that works better for workers, businesses, and families across the state. We study issues ranging from income inequality to business regulation to labor force participation. And we also focus on the well-being of workers in California. And our most recent report, we were able to combine focus group discussions with statewide representative data to better understand the challenges facing workers and their economic security today.
Thank you, Sean. And now to you, Tess. Tell us about your background. How did you get your role as a senior research associate for the PPIC Economic Policy Center? And I know you're going to get into it in a few minutes, but what does some of your more recent research look like?
Yeah, and thanks again so much for having us today on the show. I have been at PPIC for about 9 years following a master's in public policy, and all of this really for me was motivated by time I spent serving in AmeriCorps at a community health center, where I got really interested in the role that government programs and policies can play in alleviating poverty in the near term and also helping people exit poverty in the long term. So at PPIC, I actually split my time between the Economic Policy Center and our Safety Net Research Group and kind of broadly focus on how Californians cover their basic needs, including earnings and combining safety net programs, and then the role that policy plays in this area for low and middle income families. So recently I've worked with Sean on a piece about worker kind of demographics in California. I do a lot of research on income inequality, some work on wealth in California, and more on our safety net side have focused on recently pandemic expansions to the CalFresh food assistance program. And then, of course, the report that we're going to talk about today, where we looked at work and economic insecurity in California, and where we were actually able to talk specifically to workers who are experiencing economic insecurity in the focus groups that Sean talked about.
That's really interesting. And then, Sean, why did you decide to become a research associate for the PPIC Economic Policy Center, and how did your background and education gear you towards research in economic policy making?
Sure. Yeah, well, similar to Tess, in my studies that were focused on public policy, I was really able to develop a foundational understanding of the interrelated issues of economic inequality and also poverty. So in my studies, I was also thinking a lot about how policy decisions can either work to uplift people and put them on a path toward economic opportunity, or in some cases, unfortunately, create barriers for people to get there. So in my earlier part of my career, I was working on program and policy evaluations at different organizations, both at the federal and international level. So in these roles, I was part of research teams that were evaluating education programs, labor programs, economic development programs, and that's where I was really inspired by the researchers I was working with to use data and evidence to inform better policy decisions. And all of that led me back to my home state of California and working at PPIC's Economic Policy Center, where I can continue working with Tess and our other colleagues at the Economic Policy Center to try to think about policies that can expand socioeconomic opportunities for Californians.
Thank you both. Up next, we'll discuss PPIC's report, Work and Economic Insecurity in California. This is the Maddy Report. Welcome back. This episode highlights the report Work and Economic Insecurity in California, published by Tess Thorman and Sean Cremin and their colleagues, which examines data drawing the relationship between economic security and California workers. Thanks again, Tess and Sean, for joining the Maddy Report today. What main factors contribute to economic insecurity among California's workers, even when they're above the poverty line? And you noted major peaks in inflation between 2020 and now. How has this increase in inflation affected lower and middle class workers' ability to meet basic monthly expenses throughout the years?
Yeah, I actually want to start by saying when we talk about economic security, we think of this as the ability to control your finances month to month and kind of to absorb a shock if things change suddenly. We find from PPIC's statewide survey that about 1 in 5 California adults worries every day about paying bills, and it's almost twice as much among lower income families. And so in this report, we talk about how there are a lot of contributors to what keeps workers from being economically secure, even when they're technically above the poverty line. And that includes things like kind of uncertainty about hours or variability in work hours. It includes changes in health or in caregiving needs that might mean you have to take a break from working. These are all things that workers that we talked to brought up. But as you alluded to, inflation has been a really big one in the last few years, particularly from before the pandemic to now, and really especially in 2021 and 2022, we've seen prices rise, particularly for necessities. These are things like rent, food, utilities, including gasoline. Kind of by way of example, we've seen rent is up 25 to 40% in some parts of the state over where it was before the pandemic. And so, as you might expect, this really fast increases in prices made it harder for people to cover their monthly expenses. And lower income workers were particularly impacted by this because people already spend a larger share of their income on the basics in that income bracket, and it's not something that it's not optional. You can't substitute away from it.
And where in their lives do California workers end up finding themselves having to make difficult trade-offs in order to meet monthly expenses?
Yeah, so one of our main takeaways from this report was that coping with these rising costs involves difficult trade-offs for workers. Workers trying to make ends meet are often faced with hard decisions about how many hours to work, which bills to pay, and how to balance their jobs with the responsibilities that come with daily life, like childcare responsibilities or going to the doctor. So I'll highlight 2 examples of the most common trade-offs that we heard in our focus group discussions. The first is that for workers, particularly those caring for young children, they discussed needing to make the choice between working part-time and full-time. So for example, someone we talked to spoke about working part-time when she really wanted to work full-time because she figured any additional earnings she made from working full-time would just go to cover the high costs of childcare already. So she figured I'd be the one to stay home, work part-time, and take care of my child. Another example that we heard was people weighing whether or not to move to a less expensive area of the state or to another state altogether. However, some people who were thinking about this, who had even tried this, came back to be closer to family support networks or friends who were sometimes helping them financially or with those childcare responsibilities. So these are just 2 of the examples we heard of workers who discuss the ways that they're making trade-offs when they're put in a bind due to these rising costs that Tess mentioned.
And how do safety net programs come into play, and where do they ultimately end up leaving California workers?
Safety net programs make a big impact on poverty among workers. We estimate using California poverty measure data that another about 500,000 working Californians would be in poverty without programs like CalFresh food assistance or state and federal earned income tax credits. And workers that we talked to who are accessing the safety net talked about how much they valued that assistance. I will say at the same time, people also talked at some points about the challenges of getting and keeping those benefits, especially given the amount, kind of the dollar amount that they were eligible for. So safety net programs are often targeted towards people with the lowest incomes. And so you see large benefits at the low income end, and then very small benefits at kind of near the point where you're maybe eligible, where that eligibility threshold is. But everybody faces the same types of requirements in terms of verifying your economic circumstances, and those can be really time consuming and challenging. So we heard from people at points about how they were questioning whether it was worth it to go through that process to get benefits when they still felt like they had more need than the benefits could cover. And beyond that, there was a whole group we spoke to who knew that the benefits were there, but they themselves weren't eligible, even though they were still struggling to make ends meet. So kind of overall, we see that programs lift a lot of people out of poverty in California, including workers, and we heard from people that there was more need than programs we're currently covering.
Thank you. We're going to be right back after this break. This is the Maddy Report. Welcome back to the Maddy Report. As we previously discussed, California workers are left economically insecure still years after the COVID-19 pandemic and peaks in inflation. This report demonstrates how economic insecurity can affect career growth for workers in California. Let's talk a little bit about how is the relationship between stagnant wages and inflation affecting California workers, and how do personal responsibilities or job characteristics constrain California workers from pursuing other job opportunities?
Yeah, so in the report, we were able to look at long-term trends in wages adjusted for inflation. And we saw for those making the highest earnings that their wages adjusted for inflation have grown 50% since 1980. But those same real wages for those in the middle of the distribution have only grown 7%. And for those at the lowest end of the distribution, growth has only been 4%. So we've seen in the long run some growing inequality in wages adjusted for inflation, also known as real wages. But interestingly, there were a few years during the pandemic when average real wages were growing more for those at the lower end of the distribution than those at the higher end. But we heard loud and clear from our focus group participants that people didn't necessarily feel those real wage increases and really felt inflation cutting into their budgets. In addition to people perceiving that their wages aren't growing, several characteristics of lower paying jobs cause them to maybe fall short of improving prospects for economic security or upward mobility. For example, part-time or erratic work schedules can limit potential earnings, and we also know that lower wage jobs can sometimes be concentrated in certain industries that have less opportunities for career advancement. Several participants also mentioned needing to pick up an additional job or a side hustle or work in the gig economy to supplement earnings from their primary jobs. However, people mentioned how this can take away from their leisure time or time spent with their family. But on a more positive note, some workers also discussed characteristics that make it worthwhile to stay in their current job, even if it's a lower paying job. And that included having a healthy work culture, having autonomy over their schedule, or having good health benefits, for example.
And how can the prospect of losing any benefits that are currently working for someone make them maybe hesitate to take a job that might be otherwise a good opportunity for growth?
Yeah, we heard a couple times in focus groups about concerns that changing work would actually negatively impact finances. And to the point of this question, we did hear that people were concerned that they would lose health insurance coverage for Medi-Cal in particular. I think that this speaks to, among other things, the broader issue of how what are often employer-provided benefits play into career choices. Kind of what Sean was alluding to too, where, we heard not just about health insurance, but about things, for example, that can make it easier to care for family members, like having a flexible schedule or working from home, that maybe make it preferable to keep a job where you're not earning enough or you don't have opportunity for growth, but it meets some other needs that you have. I think also this reflects what we heard was a general hesitation to make career shifts when family finances feel unsteady. A lot of people that we heard from expressed that they wanted to have some stability before they made a big career move that would require investment. Like we might think of going back to school or getting some additional training where people have to take time out of work to do it. They have to cover the cost of the education, and then they have to be sure that it's going to pay off. So I think, some of the hesitancy is about changes to government assistance that's been really key. But the bigger picture is probably more about the reluctance to make a change in resources when it's already pretty hard to find a sense of stability.
And in the report, you mentioned changes in the labor market since the onset of COVID. What happened during this period, and how are California workers feeling now about leaving their jobs for other opportunities?
Yeah, as we know, the pandemic really shook up the labor market, not only in the state of California, but also the nation. It erased millions of jobs that took a couple years to recover. Millions of workers went to go work remotely, and the inflation crisis that happened in tandem really cut into workers' budgets. But after the initial shock of the pandemic in about 2021 and 2022, record numbers of employees were voluntarily leaving their jobs to seek higher paying or more flexible opportunities. In this period, we saw high rates of job openings. We saw the number of people who were unemployed was far less than the number of job openings in the economy. And this period around 2021 to 2022 has come to be known as the Great Resignation. However, the Great Resignation may have been relatively short-lived. In the last couple of years, job growth has really slowed down in the state of California. Openings have come down, and there are now almost twice as many people who are unemployed than there are job openings. And people are really staying in their jobs. And some have even categorized this period as one of job hugging. And we also know that today, federal actions, the rapid development of AI, high levels of concern and pessimism about the economy are really driving the feelings of uncertainty that people have when it comes to the labor market. And we really heard this in our focus groups, that this uncertainty is exacerbating the potential risk people see when they're thinking about making an investment in their education or making a career change when they're already in a precarious financial situation.
Thank you. We'll be right back to wrap up our conversation with PPIC in just a moment. This is the Maddy Report. Welcome back. Tess and Sean, thanks again for joining us on the program today. Before you go, I have some final questions regarding California workers' demand for action going forward. Who do California workers feel is responsible for addressing their economic insecurity, and how do California government programs maybe fall short of helping some California workers cover their basic needs? And what changes can policymakers pursue to improve this situation? I know there's a lot of questions packed into that one, but maybe if you could shed some light on this.
Yeah, we actually didn't ask workers who they thought was responsible for addressing their economic insecurity. It was clear from the conversations that people saw their situations as the result of a lot of factors. But overall, I think people really emphasized wanting work to pay off. They wanted a kind of a combination of wages should be high enough to cover my basic needs, and prices should be low and stable enough that what I'm earning can cover what I need. This was kind of the focus instead of how safety net programs should be enough to cover basic needs. But to be sure, like we were discussing before, workers talked about their frustrations with not having enough help from the safety net to cover what they needed. And one of the limits to that is that most safety net programs are federally funded and designed. So California can't always make these big design changes that might help this specific group of workers. And one kind of good example of that is how, there are the people who are struggling to make ends meet in California, but they're earning too much to actually be assisted by safety net programs because we have one kind of eligibility threshold across the country. It applies to California, but then it also applies in states where earnings tend to be lower and cost of living also tends to be lower. California has kind of taken this on in the past by supplementing safety net programs. A good example of it is the California Earned Income Tax Credit, where the state provides funding in order to kind of supplement the federal earned income tax credit for people who are earning too little to get the full value of that credit. That's kind of the original design of the California EITC. And that works when the state has money to do that. I'll just note that if we think, this is thinking very near term about covering basic needs and ensuring economic security, but government's also involved in the longer term work of ensuring economic opportunity. So we think more about high quality training being accessible and affordable for career changers. That can potentially help ensure future economic security.
And what single policy issue are California workers most urging policymakers to take action on? And why might policymakers need to take a more proactive role in reaching out to economically insecure workers?
So as Tess alluded to, the single biggest issue that came up again and again in our focus groups was that workers are really struggling with these rising costs and their wages are not keeping up. Some workers suggested policy ideas that directly address rising prices, like price controls, namely rent control, and others were looking more at the wage side of the equation, mentioning things like increasing the minimum wage. However, we know that both of these policy choices can have potential economic trade-offs. Other policy priorities that we heard to get to these concerns around prices and wages were policies to address housing affordability issues, which we know have been, pretty rampant in the state over the last couple decades. So people mentioned maybe expanding the supply of affordable housing, which we know legislators have been working on, or expanding rental assistance. Typically, the issue that people wanted to see policymakers take action on was the one that would, kind of address their greatest need in the moment. So for some, that was housing, but for others who might be struggling with health needs. They mentioned single-payer health insurance. Other folks who may have saw their utility bills spike really high during the pandemic and then the years after, talked about wanting to see ways in which those utility prices could come down. And on this question about why policymakers may need to take more proactive action in reaching out to workers struggling to make ends meet right now, we heard from workers that they were already feeling overwhelmed and already feeling stretched too thin when it came to their daily lives and balancing all that they had going on. So this suggests that elected leaders, really need to be proactive when engaging with these constituents, and particularly those workers who are struggling just to get by. And we really heard from workers a strong desire for elected leaders and other leaders in the state to really kind of understand their lived experiences.
Well, Tess and Sean, that's unfortunately all the time we have today. We're so appreciative of you joining the program, and we hope to have you back again soon. Thank you so much for your insights and time.
Thank you.
Thanks for having us.
And thank you for tuning into the Maddy Report. To learn more about the Maddy Institute, visit themaddyinstitute.org. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect the views of the Maddy Institute. If you'd like to share your thoughts about today's episode of the Maddy Report, please visit our website at maddyinstitute.com.